In this video clip, I will be introducing skeletal muscle tissue. I will cover the basics of skeletal muscle contraction types, and also discuss how you can determine how a muscle will produce movement at a particular joint. Muscles cross joints and are attached to bones in at least two places. If we start with the picture here on the left, here we have biceps brachii. We can see that this muscle attaches to the scapula, so here it is attaching to the coracoid process, and here also attaching to a point just above the glenoid fossa. And distally, it attaches to the radial tuberosity and also into the bicipital aponeurosis. This is a great example of a muscle that crosses more than one joint. At its proximal end, it crosses the glenohumeral joint, and at its distal end, it crosses the elbow joint. The next muscle here is the deltoid muscle. This is an anterior view of the deltoid, and we can see that it also attaches to bones in more than two places. Here we can see it attaching to the lateral aspect of the clavicle and also to the acromion process. It also attaches to the spine of the scapula, which is hard to see in this picture. And distally, it attaches down onto the deltoid tuberosity on the humerus. This particular muscle only crosses one joint. You can see from this picture that it's only crossing the glenohumeral joint. In the last picture here on the right, we have gastrocnemius. Gastrocnemius attaches to the condyles of the femur and goes down and attaches to the calcaneus. Again, this muscle crosses more than one joint, just like biceps brachii. So we can see at its proximal end, it's crossing posterior to our knee joint, and at its distal end, it's crossing posterior to the ankle joint. An important note to make is that a muscle must cross a joint in order to produce movement at that joint. Skeletal muscle can contract in many different ways. Often when we hear the term contraction, we think of muscles moving, but in fact, a skeletal muscle can contract in two different ways. When it produces movement, we call this an isotonic contraction, and when it doesn't produce movement, we call it an isometric contraction. Isotonic contractions can be subdivided further into concentric and eccentric contractions. Let's look at an example. In this example here, we can see biceps brachii. I'll outline the muscle. Here's biceps brachii, moving the elbow joint. As the forearm moves up towards the arm, so in this movement here, this would be a concentric contraction, the muscle shortening under tension. Whereas as the forearm lays back down or goes back into anatomical position, this is an example of an eccentric contraction. Again, here's the concentric, and now here is the eccentric phase of the movement. All skeletal muscles can produce eccentric and concentric contractions. In order for this gymnast to perform this movement, she must contract many of her muscles. However, in this particular position, she is not moving. So in this particular case, we would say that the length of the muscle has remained the same. So iso meaning same, metric meaning length. Muscles are the same length. However, there is tension developed in these muscles in order to produce this particular movement. We can determine how a muscle will produce movement at a particular joint based on where the muscle is located. The proximal end of the muscle we refer to as the origin. This is where the muscle starts. The origin of a muscle does not move when it's producing a concentric or eccentric contraction. The distal end of the muscle we call the insertion. This is where the muscle ends, and this is the part of the muscle that will produce the movement. Let's refer again back to our example of biceps brachii. Here we have biceps brachii. Again, here's the origin of the muscle, and here's the distal end of the muscle, its insertion. As this muscle produces movement, or as it concentrically contracts, when the forearm moves up towards the arm, it's contracting. The origin stays still. You can see the origin's not moving. However, the distal end of the muscle produces the movement. Here's another example. This is of triceps brachii, so the posterior aspect of your arm. Here is the origin of the muscle. So it attaches onto the scapula just below the glenoid cavity, and parts of the muscle attach to aspects of the humerus. The insertion of the muscle is on the ulna, on the olecranon process. So as this muscle concentrically contracts, it produces extension of our forearm. The origin of the muscle does not move, whereas the insertion point does move. Now that we've discussed the basics on how to determine how a muscle will produce movement at a particular joint, I'd like you to work through the following practice questions. This first set of questions refers to triceps brachii, which we can see here in this picture. Triceps means 3. It has 3 heads. There's a long head, a lateral head, and also a medial head. All of these heads converge together and attach onto the posterior aspect of the ulna on the olecranon process. I would like you to determine which bone would move when triceps brachii concentrically contracts, which bone does not move when it contracts, and what is the action it produces during the concentric contraction. Press pause to answer these 3 questions. Lastly are some questions regarding gluteus medius. Here's gluteus medius from a lateral view. It starts on the external aspect of the ilium and goes down and attaches to the greater trochanter of the femur. Can you identify the joint this muscle would work at? When concentrically contracting, which movement would occur at this joint? And when eccentrically contracting, which movement would occur at this joint? Press pause to answer the following 3 questions.